My name's Carolyn Vaught. My specialty is family medicine. I grew up in Florence, South Carolina. I went to Furman here in Greenville for my undergrad. I then spent a year in Washington, D.C. And Costa Rica, and then I went to med school in Charleston at MUSC. I couples matched with my husband at University of North Carolina in Chapel Hill for my family medicine residency. I was there for 3 years, and then I went from there to actually working in the emergency department in the hospital of a critical access hospital in rural North Carolina. And then we moved to Spartanburg. So family medicine is the specialty of caring for patients throughout every stage of their life, from newborn to the end of life. Not only do we address patients' specific health needs, but we're also responsible for taking care of their preventive health, as well as promoting health in general for them. We also are often the doorway into the greater healthcare system for patients, and so we also help them navigate that. During medical school, I was interested in almost everything. I considered surgery, OBGYN, emergency medicine, but ultimately I wanted to care for the whole patient in a holistic manner. I also really appreciated the relationships made during my family medicine rotation, and I wanted to have those lasting relationships over time with patients. I also really appreciated that through family medicine there is a great deal of variety, flexibility. You also have to consider the environmental and social determinants of health and use that to treat the patient. I think the first step is to create a trusting relationship with a patient, as well as a safe space for them to voice their concerns without any fear of judgment. I think it's also really important to empower patients to take control of their own health. I think if patients can come up with something that they can do to improve their health, it's going to be much more effective than you just telling them what to do. I also think that it's extremely important to not only try to inspire health in the individual patient, but also in their larger community. I think becoming involved in the community and finding ways to make it easier for patients to be healthy and where they live, I think is really important for lasting change. When I'm not at work, I would love to be traveling to another country. I also love hiking, gardening, really anything outside, yoga, and I also love to cook. To make an appointment with me, please call the number on this webpage.